Hi, and welcome to Rockin Rehab. I'm Stuart Wilson, physical therapist and medical advisor for RockTape. Today we're at my clinic, Panther Physical Therapy in beautiful Colorado. Today we're going to be talking about ankle edema, and especially how to get around those areas that are hard to get to. A lot of times in my classes I have people ask me, well, can you use more than one strip or two strips or three strips? And absolutely, especially when the edema is throughout the foot. So today we're going to learn an ankle edema taping that goes throughout the entire foot, on the anterior surface, medial, lateral, and posterior part of the ankle as well. So the first thing you need to do is take your client to the edge of the table. You're going to make sure that their foot's hanging off so you have an area to work with. We're going to start with the front part and the sides first. So you're going to cut 3 strips with only 3 cuts. So I call this 3x1, 3 in the front, 1 in the back. Your first strip is going to be along the front, and it's going to go to the edge of the toes, straight down the foot, and they can go ahead and plantar flex so they're in that loaded position that we always follow. You're going to start with your tab, rip off a starting point, pre-measure where you want it to be. Take the tape down, but don't stick it down quite yet. This is called a pre-tack. Once you get that on, go ahead and lift up one strip, trying to minimize how much you're touching it. Lay that on. Take your next strip, go down the front to make sure that you stay off the toes. That one as well. Rub those on to make sure that you get them on nice and good. Then you're going to take your next 2 strips and you're going to go diagonal with it. So you cover the lateral part of the foot with this one, medial part of the foot with that one. So lay it out. You can go past the foot. I think it stays on a little better if you go past the edge of the foot so it doesn't rub on the ends and it keeps it on. Backtrack it so you know exactly where to start. Pre-tack it. Come in and grab each piece, especially hitting those really swollen areas throughout the foot. Have them inverted a little bit while you do it. Really get those sides of the foot where you have the most swelling. Next, you're going to do the medial part of the foot. That's going to look a lot like the lateral part. Have them evert, staying out in that position. Again, go into the foot a little bit. Roll just a little bit to start your tape. Tack that on. And then plant it again around that swelling. Wherever it's swollen, you want to cover that area. Rub it all on to make sure you got it. And then we got to worry about the back part. So I'm going to have the patient flip over. And we're just going to run this down past the heel so that it stays on. Have them dorsiflex as much as they can without pain. Again, plan your attack. Start here. Run down the back of the ankle. Grab those sides, lay that on. So you have 3 in the front, 1 in the back. You're covering the entire foot and ankle with this one. If you could roll to your back for me. And then show them how you get full coverage of that foot. Lateral side, anterior, and medial surface, as well as the back part. That's how you do a 3x1 ankle edema taping to cover the entire foot, anterior, medial, and lateral, as well as the posterior. For more information, visit our website for when classes are. And until then, keep rocking the rehab.